Active Arkansas, and Dr. Morgan Sauer from St. Vincent's Longevity Center is here to talk about some of the additional dangers binge drinking creates for this age group. Thank you so much for being here. We appreciate it.
Thank you for having me.
Sure. Now, this is a new study, is that right, that kind of showed this group, and it's easy to think when you think of binge drinking to think of college students, but that's not what it's saying.
No, seniors are very good at this, and they're doing it far more than we imagined. Think about it. You're retired. You've got time on your hands. If you drink too much and have that hangover, you don't have to worry about going to work the next day. You can sleep it off. So there's a lot more time, and there's a lot of social issues involved with drinking.
It makes a lot of sense when you actually kind of stop to think about it. Now tell us about with this age group specifically, what other issues can they be facing when we're talking about alcohol like this?
In seniors, we know depression is common. People are trying to self-medicate to take the pain away. They may have loss of social isolation, loss of spiritual contact because of medical illnesses. Chronic medical conditions can cause pain. The children may not be there. We're living farther apart, so there may not be grandkids there for them to help participate in raising. So if there's nothing else to do, let's hit the bottle.
Now, should there be concern for the adult children if their parents fall into this group?
There has to be. Drinking is not good at any age in this type of setting. When you take large amounts of alcohol at one time, seniors are definitely much more fragile. They don't recover as well as younger folks. So you can have gait and balance problems, which can lead to hip fractures, wrist fractures, hitting someone's head and bleeding into the brain, whereas they would not have had these risks when they were younger. Also, alcohol interacts with a lot of medications, and the number of seniors on medications is huge.
Some really good things to think about. Now, what can this generation do about parents that might be a part of this group?
We have to pay attention to our seniors. They're a fun, entertaining, really well-trained group that we can learn a lot from, and having more cross-generational communications and more cross-generational activities, and also just beware. Call your loved ones, spend time with your family if you're someone our age that has parents who are seniors. Doing that, keeping an eye on things, and being alert and being aware.
More good words there. And finally, it's different from alcoholism. Talk about how that's different from binge drinking from actual alcoholism.
If you have alcohol dependency, your body requires alcohol. It's so used to having it that it's got to have it. And if it doesn't have it, it will punish you severely for not giving it alcohol. That's when you definitely have got to get medical help to treat. Binge drinking, people could drink 6, 7, 8 drinks, and then they can go for 3 or 4 weeks and not have the cravings and not have the I've got to have it sensation from the body. And so they're not chemically dependent, but there can be a psychological addiction. Both of these are important, and both of these need medical treatment.
And you could almost argue that the binge drinking would be almost harder to identify because it is almost, they're not dependent on it, and so it could be almost more difficult. So some great advice on how to approach this. Thank you so much for being here today. We really appreciate it.
Thank you for having me.
And we'll try to put some information on our website to if people need some help or have any other questions about this, if they're one of these people that might be in the situation.
Very important to do so.
Wonderful. Thank you very much.